Hello, everybody. Good evening. My name is Julia Lee, and I'm a doctor of traditional Chinese medicine, and I'm based in Sunnyvale, California. Today, I'll be talking about acupuncture as well as other related modalities that work very well with acupuncture within the field of Chinese medicine. So before we get started on the content, I wanted to make a disclaimer that this talk is for educational and informational purposes. If you have any medical issues, please consult directly with a healthcare provider. So what is acupuncture? Sometimes people think that, they know that it has some vague relationship with needles. And on the right, you can see that sometimes people think it's like a ninja throwing darts at some really terrified patient on the table. But acupuncture is really nothing like that. It's more like the picture on the left of a calm and relaxed individual who is placing needles in a very calm and relaxed patient. So acupuncture is the most common modality of Asian medicine in the West. It involves the placement of sterile needles and points along the body's energy channels. Some of the positive benefits of receiving acupuncture include strengthening the immune system, enhancing circulation, regulating hormones, calming the nervous system, relieving pain, and reducing stress. So you can see on the below right, there's a acupuncture model of a person, a figure with some of those major energy channels in red. I'll describe this briefly because the idea of these energy channels is not well known here in our culture. So I like to use the example of Bay Area traffic to talk about these energy channels. Just like we have the major highways in the Bay Area, such as Highway 280, 101, and 880, these span the entire Bay Area and are really important for transportation and just so much of the supplies we need are even transported along these major highways. So just like that, our body has major highways where energy flows, and as the traffic in the highways can sometimes create blockages, also there can be blockages in these major energy channels in our body. The body has a self-regulating mechanism for clearing up blockages, just as on the highways, sometimes cars will then divert into the smaller side streets, and we have personnel that are really good at clearing up the blockages. But sometimes the blockages can get to be too much, and then the body becomes unbalanced, and then that is when symptoms show up, such as pain or discomfort. One question that people are interested in is how ancient is acupuncture? There's no exact date for how long acupuncture has been around. Usually in Asian medicine, we just know that it's been around for thousands of years. I like to use this example of an ancient mummy discovered in Austria in 1991 to exhibit that the theory behind acupuncture could be extremely old, even before the earliest signs of its existence in Asian culture. Scientists date this ancient mummy that was discovered in modern Europe to be from 3300 BC. So we're here in 2021. 3,300 plus 2021 is more than 5,000 years ago that this mummy was a living person. And interestingly enough, when he was discovered with a pouch of medicinal herbs next to him, and also more than 50 tattoos on his body in locations that align with what are now known as classical acupuncture points. So it's possible that in primitive times that people in different parts of the world have come to an understanding that there are certain spots on the body that might have therapeutic value. The energy channels I discovered not only exist in what is now modern, many different cultures around the world. In Thailand, in India, and in Tibet, they have many ways of characterizing this flow of energy in the body. And these are some pictures from Chinese medicine of these sketches of these energetic flows within the body. So this idea that there's interconnections in the body, deeper interconnections, is becoming more and more well-known in the West as well. So in 2014, there was this book published by Thomas Myers called Anatomy Trains, and he depicts these myofascial meridians that span the course of the body. So this is how the muscle and fascia is connected. And if one, for example, has a neck pain or spasm, that this pain or spasm can be related to perhaps something, going wrong in the glutes or in the hamstrings or in the lower leg. and it's not limited to one part of the body alone. This idea in recent times is becoming also well known and discussed in my own field, where because these days Western medicine and Chinese medicine and other forms of medicine are coming together in our globalized society. So this book, The Spark in the Machine by Dr. Daniel Keown, has really taken my field by storm in recent years. Dr. Keown is a doctor of Western medicine who also then studied Eastern medicine. And in merging together these different worldviews, he believes that these energy channels could be related to the network of fascia in the body. So in the classical Greek and Western medicine, doctors learned anatomy through dissecting the cadaver, which is a human body that is no longer living. And so you can imagine that in those cases, then because the body is no longer living, it is stiffened and the fascia is no longer it's different from when it's a living body and the fascia is fully alive and this energy channels flowing through the spaces in this network. And when the body is no longer living, then these energy channels no longer have any flow and it collapses and stiffens, and it was not discovered in a physical material way. Below, I have some pictures from a recently published study that just came out in March of 2021, so less than 2 months ago. And the study depicts that some scientists have injected fluorescent dye into acupuncture points. And they track this flow of the dye using our modern high-tech equipment and see this fluorescent flow traveling along the exact meridian pathway that has been known throughout Chinese medicine history. So acupuncture is one modality within the ecosystem of Chinese medicine. And in this ecosystem, there's many other modalities that pair very well with acupuncture, such as herbal medicine, Moxibustion, cupping, and more. So I'll briefly discuss on some of these other modalities because they're very important in understanding the whole ecosystem of this medicine. Because for a given case, if the patient is receiving all the different modalities that will best facilitate their healing, then this would expedite and speed up the person's healing, and they could probably heal at a deeper level. Before I jump into those different modalities, I like to use the analogy of a car to explain some of these differences between modalities, because many of these theories of Chinese medicine can be new to many people who are first hearing this for the first time. But we're all very familiar with cars because we probably drive one almost every day and frequently see them on the road and are familiar with taking care of our cars. For example, at least once or twice a year, we probably take our car to a mechanic and perhaps get an oil change or change our tires or do some repair and maintenance on our car. So when we take the car to the body shop and the auto mechanic takes a look at our car, they have good hands-on skills, techniques to make sure our car is functioning properly. And so, for example, there's parts that need to be swapped out, and you can see this person using some sort of tool or screwdriver to make sure the parts are well put together. But also, a well-functioning car needs to have fuel. It needs to have coolant, and it needs to have oil. It has all these different substances that needs to be in place for the car to be functioning smoothly. So a good mechanic will also diagnose your car's situation and make sure that it has all the necessary substances so that you can safely drive your car. So in this way, we also in Chinese medicine, we have the hands-on portion of treatment, such as when you come in and you are on the table and there's acupuncture, cupping, and other hands-on modalities that the practitioner will do for you. But also, there's the part that is similar to making sure your body has enough substance, which is the fuel to run, the coolant, oil, so on. So in that case, not only is in the case of fuel, our diet is our most important daily fuel that we take into our bodies and that we are responsible for ourselves, just as we get gas for our cars and we are responsible for fueling our cars ourselves. But in the case when our body becomes very off balance due to some reason, or due to stress, due to the various circumstances of our lives, then herbal medicine is a more intense fuel that requires the prescription of a practitioner in order to also help make sure the patient has enough of the substance that is required to be functioning at a high level of performance. So herbal medicine is a true jewel of Chinese medicine, and it requires, it comes from a lot of cultural and philosophical understanding. It involves the many parts of plant matter, such as roots, branches, seeds, and even sometimes animal parts. And the practitioner puts together a formula based on the patient's needs. The patient then takes the herbs home and takes them on a regular basis. It involves cooking the herbs and remembering to incorporate this as a part of their life. So herbal medicine is customized for the individual, and that is part of where its power lies, because it is really targeted based on individual needs. And these are two examples of herbal formulas that I had put together. And you can see that there's some aspects that are similar, but also aspects that are different. And based on the patient's needs, we carefully craft the dosage of all these components. And it requires the feedback of patients. So when you've taken the formulas, it becomes a process of becoming more and more in tune and sensitive to your body and as it responds to the formula. And then the physician continues to adjust the formula based on how the person continues to change and grow. I put here also that herbal medicine is an art and a discipline, because it involves an artistic view of the body and also in understanding the artistry of putting together different dosages and components that they're just as people get along with each other, different herbs have there are certain ways to pair them that they facilitate each other in a synergistic way for deeper healing based on the patient's needs. On the right is a picture that a patient sent to me. He texted this to me one time after as he was cooking his herbs. And you can see that it is an artistic display too, and a discipline that requires his effort and his stovetop. He's put into a ritual format where he will take the herbs on a nightly basis. So we'll switch gears here and talk about another hands-on treatment modality that pairs very well with acupuncture. In my clinic, I often do cupping first and then acupuncture after that. And so cupping in recent years has become very well known in the media. And this is thanks to celebrities such as Michael Phelps, Steph Curry, and Gwyneth Paltrow. You can see on Michael Phelps' shoulders that he has some dark circles. And when he went to the Olympics and people saw these dark circles, they wondered what it was. And that was one way that propelled cupping into the mainstream consciousness in recent times. So why are there these dark circles from cupping? The dark circles appear if there's stagnant qi and blood flow. If there's no stagnation of blood flow, if your blood is flowing very smoothly, then there will not be these dark circles. And as you can imagine, Michael Phelps is a very hardworking athlete who is pushing himself to great extremes, and his muscles are working at a furious pace. And what happens is sometimes waste products and there's some stagnation that it can occur. And cupping is a way to help break up this stagnant blood and improve his circulation. One thing I really like to mention about cupping is that it has a worldwide historical legacy. Though now it's often affiliated with Asian medicine, but worldwide, there's ancient sculptures and drawings of people receiving cupping or the modality of cupping, the tools of cupping. And in ancient Egypt, ancient Greece, there's different cultures where cupping was a part of their history. One thing I enjoy about practicing in the Bay Area is that there's many people from all over the world. And it was very interesting for me to work with patients from Mexico or from Greece or from Iran and hear about how their culture also has cupping and how their ancestors, grandmothers, or mothers would do cupping for them, or they would watch movies from their culture and see cupping practiced as a form of healing. Moxibustion is another important modality within Chinese medicine, and it pairs extremely well with acupuncture. And in the camera, I'm holding my fingers like this. This is how much intertwined acupuncture and moxibustion used to be. It was actually in Chinese, acupuncture is zhen zhou, Zen meaning the needle, and what we now know as acupuncture, and Zhou refers to Moxibustion. So in the past, it was always very much, the practitioners knew and practiced both often together. But in modern times, as you can imagine, in a lot of modern offices where this burning of the mugwort herb can be causing a lot of smoke, or the scent can be very strong, and sometimes people just don't really like it for some reason, then it's not as well known in the West as acupuncture. And I'm holding up in the camera a box of smokeless moxa sticks, because I usually use these in the clinic if using them at all. And for the people who can really benefit from it, I often teach them how to do this for themselves at home, because really just doing this once in a blue moon will not be enough to totally shift your health condition. It's something that needs to be a discipline and incorporated into one's life. And so I would often, at the end of treatments, if necessary, teach someone how to do this at home, and then they can also be empowered to be part of their own healing. Some modern uses for acupuncture include some that I have already mentioned, such as improving circulation, boosting immunity, improving digestion, sleep, and relaxation. And intuitively, we can imagine that acupuncture can be helpful for pain relief. If there's some sort of tightness or spasm, it just intuitively, we can imagine that it makes sense that putting needles into the body, into areas of the pain, or distal, farther away from the pain, it can be helpful to smooth out this stagnant flow of energy in the body. In recent times, acupuncture has been also known to be helpful in fertility and women's health, and also for addiction recovery and mental health, because acupuncture can help quickly shift the body from a sympathetic nervous system mode of fight or flight and stress into the parasympathetic dominant mode of resting, digesting, and healing. So this picture here is one of my all-time favorite pictures. It's on this black and white photo is from this book by Dr. Shigehisa Kuriyama, who is a historian of medicine at Harvard University. And I love this picture a lot because it puts just side by side this view of old-time Chinese medicine and Greek medicine. On the right, you can see a picture from the 1500s of an anatomical drawing and this drawing, you can just see it's totally so much physical detail, just every muscle fiber and bone. It seems like it's this complete understanding of the physical body in great intricate detail. And on the left, it's a almost cartoonish drawing. It's from the 1300s, and it just shows this person, and you can see, yes, they have an arm and a leg, but there's not that great level of physical intricacy and detail. The emphasis is on the interconnections within the human body, those energy channels I had mentioned before, or in Chinese, we call the Jingluo, the meridians. Also, all those Chinese characters are indicating different acupuncture points on the body. Oh, so one thing I did want to mention here is that when I first saw this picture, I just thought, and I first started learning about these different forms of medicine, I just thought it was so shocking that such different forms of medicine can even coexist at the same time. So I grew up in Sunnyvale and in the Bay Area, and mostly had encountered Western medicine throughout my life until my 20s, when I learned about Chinese medicine through different incidences in my life. And I remember it was just so shocking to put together these different worldviews. How could such different things coexist? And in our globalized society, this is one of the very big challenges we have, is that all these different worldviews and opinions colliding in our more close-knit global society. And so one story I did want to mention is that of the blind men who are trying to understand the elephant. And there's a story of these different blind men who were placed at different locations around an elephant and trying to feel out what this elephant is about. So if you were standing next to the trunk versus the foot or the tail or the ear or the flank, you would get a very different understanding of what the elephant is about. And if we were just standing next to our segment of the elephant and believed very firmly that that stood for the entire truth of the elephant, then we would argue with all the blind men would argue then about what they were feeling, that the elephant must be more like a trunk or more like a leg or more like a tail. And how could you possibly be speaking about something else? But if these different blind men were willing to understand that they were standing in having a different perspective of the elephant and shared with each other very respectfully about the view of the elephant they have, then it's more possible that there would become an integrated or more holistic and complete view of the elephant that would benefit everyone trying to understand the elephant. And so that's my perspective on how, if we have all these different views on medicine, and often people can become very polarized about the view that they have. But if we do work together, then perhaps we can have a better understanding as a whole. In Chinese medicine, in a lot of old traditional medicines, there's a belief that humans are between heaven and earth. So we are the species that walks upright and like a rod upon the earth, and our heads, the crown of our head faces the heavens, and our feet are flat on the earth. And no other species walks in this form. And so the mandate that in Chinese medicine we say that humans have is that our role is to be between heaven and earth, channeling the wisdom of the heavens into the material world of this earth. And just as the hummingbird or butterfly or squirrel or dog or cat, like they all have a different role here in this ecosystem that we share, then humans also have a certain role that we play on this planet. And if we forget that our role is between heaven and earth, and that we are perhaps beyond or above heaven and earth, or who cares about heaven and earth, that can be starting to lose sight of this delicate ecosystem that we're a part of. And as more pollution and toxicity affect the balance of our planet, then different climatic factors can be a cause for disease. So I'm based here in Northern California, and we're facing wildfires almost every year. And last year, even there were 2 days when the sun was blocked out by the amount of smoke and debris from these fires. And so that just shows that if there's a lack of understanding of our delicate ecosystem and the role that we play, that it can be very hazardous to our health. And it affects the health of all of us in this region, our respiratory health and our lungs, which in these times we really need to take care of. And other factors for disease include imbalanced emotions and unhealthy habits, or being born with certain tendencies or constitutional issues that we must learn to manage and work with throughout our lives. So what then is a healthy lifestyle? For health, at least from the viewpoint of Chinese medicine, is that there is a moderation and regularity with how we consume and how we live our lives. And then there's a balance between being active and also resting. And this is also important, cultivating a calm state of mind, because sometimes there's so many things inundating us. Amount of marketing or different information can feel like a fire hose, drinking out of a fire hose. And it's important that we take charge of what we allow into our consciousness, and to facilitate actively building a calm and peaceful state of mind. And it's also important to feel that we have purpose and meaning in order to have the drive to overcome many of the obstacles that we face in life. So here are some of the pillars of health that we discuss with patients when they come for treatment. And these are very foundational for having good health. If any of these pillars are off, then it is very possible that a disease might arise in the future. Very important is our diet and what we consume into our bodies, and exercise on a regular basis. Also making sure that we sleep at a set time, and waking up and feeling rested is also very important. And as I mentioned already, the mental and emotional state is really key in these times, that we make sure that we are staying grounded and staying calm and peaceful despite all the turbulent things that can be going on in our lives. So if any of those pillars that I mentioned goes off balance, then acupuncture and its associated modalities can facilitate a restoration towards balance. The body is always seeking to rebalance itself, but sometimes if it becomes too off balance, then it can sort of lose its way, especially if we're not sure what health really means. So some of these quotes I put up here by Katy Perry, Natalie Portman, and so on, they talk about how when they are stressed or if they are feeling unbalanced, then they get some sort of body work, such as physical therapy, acupuncture, massage, and that can be very helpful for starting the process towards rebalancing one's body. So what is the treatment process like if you come for a treatment for acupuncture or Chinese medicine? Then first, there is a diagnosis where the practitioner will talk to you and examine your body. And then there is a table treatment. Just as I mentioned, the mechanic will check out your car in the body shop and do the hands-on work. Then your practitioner will also do the hands-on work necessary during the treatment. And after that, the patient is given lifestyle modifications, herbs, and exercises to do at home. So this part is also extremely important. It's just like if you are a piano student and you went to go study with piano from someone, and then they would have the lesson, and afterwards you must go home and practice in order to fully get the benefit of the lesson and to make the improvements that are necessary to your skills. Also, athletes, if you go to a coach for training, then after the coach has given you the proper advice and exercises and ways to improve, then the athlete must also spend a lot of time to incorporate those suggestions into their life. And so this is actually very similar, going for treatment and receiving all these ways to work on your own healing. Is that this is actually teaching the art of living, the art of healing, and these are ways to make your life more in tune and to continuously work on one's lifestyle and to build a greater and greater level of health and consciousness and happiness in one's life. So in traditional Chinese medical diagnosis, it's very important that in this diagnosis actually relies upon the physician's trained senses. And so we don't have the fancy diagnostic equipment of modern medicine, although I'm very grateful for that because often it gives an even more in-depth view into the patient's internal body that can aid our traditional diagnosis. So in our traditional diagnosis, we visually inspect the patient, we check the person's tongue, we feel their pulse, and we press on different points of the body to check whether there's sensitivity, and the body will reflect. The body is very smart. It will reflect whether there is issues going on the inside. Also very important is listening and asking questions. And the more a patient is aware of their own internal state and can communicate it to the practitioner, the better I can do my job for the patient. So I highly encourage that of all my patients is that they are staying very self-aware and doing their best to track their own progress and really owning their healing journey. And so there are many different settings for receiving acupuncture treatment. There is the community acupuncture clinic setting, which is on the left, and that is very focused on acupuncture. And often there's not a lot of those other modalities I mentioned that are in place, but it is a very good community setting where you feel like you're healing with many people around you. And it's often affordable, budget friendly, and the practitioner will see many people in 1 hour. There's also myself next to that picture, and I'm weighing out herbs there because when my patients are usually on the acupuncture, during their acupuncture treatment, then I am weighing out herbs for them and prescribing the internal medicine for them. And usually the time on the table is roughly about 35 minutes, I would say. And further on the right is a picture of someone in the hospital setting. So now in Western medicine, they've also done many studies and found many good uses for acupuncture that fit into their organizations. So for example, at Kaiser and Sutter Health, they have an acupuncture department. So if you are a member of those organizations, that's also another way that you can check out acupuncture if you are interested. So does acupuncture hurt? People think of needles and that often seems to be involve some sort of pain. But I would say that it feels more like a slight pinch, and positive sensations that arise from acupuncture include the sore, distended, heavy, or tingling sensations. So in Chinese, we call 酸胀重 or ma, and those are classical de qi or the arrival of qi sensations. And people learn to, at first it might seem kind of odd to feel these feelings, but actually that it's good to feel something. It's your body responding to the treatment. And then people learn to over time welcome and find that these are very helpful sensations to have. So I have a comparison here of a medical syringe, a matchstick, sewing needle with the acupuncture needle. And you can see how thin the acupuncture needle is compared to, for example, a syringe, where if you were getting your blood drawn, or if you were having something injected into your body, if you were being vaccinated, that needle is much thicker. So that needle sensation is not at all like what kind of sensation you would have from an acupuncture needle. So of course, safety is our first priority in any sort of medical treatment. It's really important that the patient is aware of what is the informed consent behind any procedure that they are receiving and that they feel safe in that context. So all acupuncturists learn clean needle technique in acupuncture school. And there's a practical portion that we also have to pass. And it's all about how to maintain a clean and safe field of work with your patient, and such that there's no cross-contamination, that there is no sort of spreading of any disease. We're always very cautious about that. And we are always wiping things down and cleaning, washing our hands. All these things are very important. And we have now in modern times these disposable needles that are mostly used in acupuncture practice these days. And they come in a variety of lengths and sizes. And depending on someone's sensitivity, you can also request for a thinner needle, or depending on also the place that you are being needled. For example, if it's a very bony place on the head or versus a very fleshy part of the body, then the gauge of the needle and the length of the needle will be different most times. And then after the needle is used, they are thrown away into the waste bin. There's a special red bin for all biohazardous waste, and these are disposed of in the proper facilities so that it's always a safe and clean process. So how do you go about finding an acupuncturist if you are interested in trying this? And so we are all licensed in the state of California by the California Acupuncture Board. And that is important in order to practice in this state. And if you're watching this from a different state, then many other states, they go by the National Regulatory Agency, which is called NCCAOM. And there's 4 board exams for that national title that involve Chinese medical theory, Western medicine, acupuncture, and herbology. And our state has their own licensure exam that also incorporates all these theories, but in these different topics, but there are just one license exam versus the 4 there. And common ways of finding an acupuncturist include word of mouth or also online search. And I would say these are 2 of the common ways that people have found me in practice. Word of mouth is really good because you can ask your circle of friends, for people you trust, to refer practitioners that they trust. And for online search, that's also a good way to go about it, because these days you can go on Google and find someone who is located near you, and that's convenient. And you can also read their website and contact them through their either phone or email, and then check with them whether what they think about your condition. And I would advise, just talk to the providers and see how they respond, and see if you feel a connection and feel safe and comfortable and feel like they are caring about you and have some rapport with the person. Because in order to heal and feel, it's important to feel safe and comfortable in whatever setting that you want to go to for the healing. So growth in natural medicine takes small steps over time often, especially if it's been a chronic problem that has lasted for a long time. Of course, if it's a very acute issue, then if it's more recent, then it also goes away more recently usually. But if something is very deep, very chronic, if something has been an issue for a long time, then it does require a lot of patience. And I like this picture of the ladders, because on the left, you can see this ladder with lots of small rungs. And then this person just climbs up very quickly. And it's also very safe because you're taking small steps. And you can see before long, that person is high up in the clouds. And on the right, that ladder with the huge spaces, the person is just, it's even hard to get onto the first rung because you're trying to make big leaps. And even if you did climb onto that first ladder rung, and from there you're trying to make a leap at that height to another rung, that's very dangerous, and one could fall in that way. So that's just an analogy for why, for example, small steps can be safe and even efficient towards reaching one's goal. I have also here this book called Nourishing Destiny, and it's become a modern classic in my field. And I have it here because that title, Nourishing Destiny, it really exemplifies what the deeper workings of traditional medicine, traditional Chinese medicine is about. It's this concept of Ming, of destiny, is we're working to unlock someone's full potential and help someone really live out their life to the fullest. Transformation takes time and it takes patience, but the good thing is that it's a natural process to transform. As you can see with this caterpillar and butterfly, is that if the caterpillar was told that one day it would be a butterfly, it might be shocked. Like, how can this even happen? That if he was just crawling along this branch, that one day this caterpillar could fly. It seems almost impossible, yet it's a process that's natural. But it does take time. And, you know, if anything, it's the willingness to just not overthink things and just go with the flow and go with nature and not let oneself be blocked, that such transformation can be possible. I like to use the car analogy a lot. So for any symptoms that one is experiencing, I also like to talk about the check engine light that we have on our cars, because we're all basically taught that if we see any lights flash on our dashboard, we have to take it seriously and we need to take it to the mechanic, you know, to check it out for us. And it's much more worthwhile to take the car in earlier than have it break down because we ignored all these lights that were flashing on our dashboard. So these are like the body's symptoms. The body has its wisdom and it doesn't talk using words. So it has a form of gaining our attention, which is such as pain, such as discomfort, and showing up almost like these smoke signals for asking for help. And so I really urge everyone that in our lives, it is very likely that we will have symptoms of some sort, whether ourselves or people around us, and that we take that time to listen to the body's language and to seek out people who can help interpret the body's language. And so I think I'll end here with this slide about how our approach really matters in healing, whether we are a practitioner or a patient. Often in our society, sometimes we get bogged down by thinking that there's a dualistic opposition between different approaches, different modalities of medicine, such as East versus West, or such as modern versus traditional. But actually, it's not so much about the modality as it's about our approach behind the modality. And today I'm sharing with you a lot about acupuncture and its associated modalities, but there's many, as they say, you know, there's this saying that there's many ways to skin a cat. So for people of all different personalities and from all different places, acupuncture might be something for you to try, but it might be also something else that you will resonate with. And whatever approach you choose, I would say that whatever modality we choose, I would say it's the approach, the heart behind it, that is really what is key. Because as the pillars of health, you remember, such as diet, exercise, sleep, all of those pillars are not limited to anywhere on our planet, to anybody, to whether you are rich or poor, or whatever country you are from, or what language you speak. You know, we all, having a healthy diet, sleep, all these things, exercising, maintaining a peaceful mind, all these things are common to all of us as humans. And so within that, whatever approach we take in healing, I would say that there's kind of two broad ways that one sometimes approaches healing. One is what I call the liberating approach, which is about healing the root and actively changing, taking responsibility, but requires discipline and the choice to live in harmony with nature, to listen to your body's symptoms, and to become more and more independent and mindful and self-aware. But the other approach, sometimes that it's not on purpose, but sometimes people can end up falling into this, is that it's becoming a process of staying stuck, where we're just trying to get rid of symptoms and not dealing with what the symptoms are about, and that there's a reluctance to change and face what the actual issue is, and just a lack of trust on our own inner resources, and this dependence on some outer resource to just put all our hopes onto this outer resource and not own up to our internal power and also the internal responsibility that we have in this healing journey. And so with that, I'll end my presentation here, and just also very much always looking for this unity within the healing arts and within the medical realm, that our heart as a true healer is about helping people truly be free and happy and be independent and really free of suffering. And that, hopefully as people, we find more and more unity in that. So thank you all very much for listening today. As I mentioned briefly, that I was born and raised in Sunnyvale, and I went to the library a lot as a kid and borrowed books there. And so it's an honor to be speaking through the library and be hosted by the library today. And if anybody has any questions, I'll use some time here to answer any questions that you might have.
Thank you so much, Dr. Lee. It looks like there are already a number of questions in the chat. While we go through these, if anyone else has questions, please feel free to drop them in there. So first, you already touched on this a little bit, but can a person who is scared of needles ever get acupuncture?
Yes, I think the key is to go to a practitioner who is just very confident in working with people, because I think a lot of people are very nervous the first time they come. But because for example, I and many of my colleagues, we've worked with many people who have never received acupuncture before. And because for us, it's just so natural. And so we're very at ease, that our ease usually puts other people at ease too.
How frequently does one need to get acupuncture treatment in order to make a lasting change in the body?
Mm-hmm. So that very much depends on what kind of situation you're in. So for example, some physical injuries, or if you're going through some, for example, or a stroke patient, someone who just had a stroke. I've seen patients that come for treatment like 2 or 3 times a week, because their situation is very serious. And then if they actually catch things at that very critical junction and get enough treatment at that time, then actually can make a quicker shift. But in my practice, because many people drive a little bit farther and everyone's very busy, then many people come once a week, and then I prescribe herbs that they can cook at home. So there's always ways to balance, and there's trade-offs with different approaches to doing this. Because also if you're coming for treatment multiple times a week, that can be a lot of time. It can also be a lot of money. So how you choose to, what situation works for you is something that you can negotiate with a practitioner. But definitely there needs to be a threshold of work being put into this to see the results. And that also includes if you can put into place a lot of the changes that people suggest to you, then that can also speed up your healing.
So this one I'm hoping that you can generalize a bit, because we do have some people from out of the area. Mm-hmm. Do you and other independent acupuncturists take insurance?
There are many who do, and that depends on the way they are practicing. So for example, there are certain codes for insurance that they will be willing to reimburse. A lot of them are pain related codes. So that depends on what kind of situation you have. So I do a lot of internal medicine and herbal medicine. And so actually, like most of my patients, I will give them a receipt if they have insurance companies that they can submit the receipt to. And anything you need from me, I will give to you. But I don't actually work with an insurance company myself, because herbal medicine is not something they cover.
Okay, this one is a multi-part question. Is Chinese medicine still evolving to meet new challenges? For example, is there research going on in your field to address COVID-19? And has Chinese medicine encountered anything like COVID-19 before?
Mm-hmm. Yeah, so there's I think a Chinese medicine and Chinese culture is always very open to adopting new philosophies and constantly trying to upgrade itself. For example, we have some herbs in the Materia Medica, such as Ruxiang and Mo Yao, and those are frankincense and myrrh. So those did not originate in China. But then when along the Silk Road, there was a lot of trade. And then when people encountered these substances and found that they have tremendous healing power, then they just got swallowed up into our Materia Medica. And also in China, in Asia, you can see that they have been very open to adopting modern medicine. And it's been a true gift to have Western medicine and what really is just modern medicine now, because it's not limited to the West. But anything that is helpful, I think in our field, we're willing to adopt and to see how we can work together for just the betterment of everybody. And as for COVID-19, in China, there is research being done on this. So that's something that you can look into if you're interested. And China has been a country that has faced a lot of pandemics in the past. So in our culture, they're just, if you hear the words wenyi, which means the warm pathogen, warm viral disease, everyone is terrified because throughout history, there's just been hundreds of plagues that have just really destroyed parts of the country, and everyone has an alertness about such things. Did I answer all of the parts?
I think so, yes.
Okay.
If not, then, oh yes, in the chat, the person who asked the question says yes.
Okay.
All right, next one. What are acupuncture points for leg cramps at night, such as when sleeping?
Points for leg cramps?
Yes.
I think that often actually, you might want to check your potassium levels for that. That's something to consider, I would say.
Someone in the chat has a question for me, which is this presentation recorded and will allow replay? Yes, this presentation is being recorded and it will be uploaded to YouTube later this month, and the link will be sent out to everyone who registered. Will acupuncture work for everyone, or is it something that works for some people and not others?
Yeah, that's an interesting question because all these, so one way, okay, so in modern medicine, they've been doing a lot of research on acupuncture, and there's many, many research studies, but there's not an absolute total one size fits all way of acupuncture. And so that's caused this limitation with how it's been adopted in the hospital setting and also with insurance, because a lot of what has been very pronounced in research studies has been pain studies. But the thing is, many people have pain for different reasons, and often actually in Chinese medicine, there's internal causes for the pain. And so unfortunately, sometimes it depends on this match that you get, you find the practitioner that actually is able to diagnose you and is able to relieve your issue. And so sometimes there's a little bit of trying different things. And in my own healing journey, I had to search out different acupuncturists even. So if you go to someone and, unfortunately, maybe their expertise is not in your injury, there's a lot of different areas that people have more skill in. And if it just doesn't happen to be the area of your injury or your issue, then you can always try other people in the field and just continue to seek out what might help you.
So we got a couple of similar questions, so I'm going to combine them. Does acupuncture help someone going through chemotherapy? And then someone else asked, do you recommend acupuncture for patients in cancer treatment or post-treatment? Yeah,
so in our, for our licensure here, they don't, so we don't treat cancer directly. That's how our scope of practice is. But it's been shown that acupuncture is really helpful for the side effects of chemotherapy. And so that's something, if someone is going through chemotherapy and they're having side effects, then it could be very helpful for them. But I would say that I've once shadowed a doctor who was treating someone with leukemia, and then the patient was very, very thin and very deficient, and the doctor was using herbal medicine instead of acupuncture, because if someone is very, very deficient in energy, then acupuncture is like too stimulating for them. So it's still very important to look at your individual issue, but on a kind of a broader scheme, then there are ways that acupuncture can benefit, especially if there's nausea or any bad side effects from chemotherapy, then it's something that you could check out.
Are most acupuncturists also trained in the other modalities of Chinese medicine?
It's something that we learn in our schooling, but it's our choice afterwards what people choose to specialize in and how they distribute their practice.
Can acupuncture help with digestion, or is that something where you would switch to something like herbal medicine?
That really depends on the issue that is present, for what kind of digestive issue is present. But I would say that there often is a lot of benefit from acupuncture with any digestive issues, because some digestive issues also relate with just a lot of tension and stress. And also, a lot of times when people receive acupuncture, even for just not related to digestion issues, they start to feel this gurgling, like it's a symptom, it's a sign that the qi is moving, that often people are saying that, they feel some movement in the abdomen and it's triggering some sort of movement in their intestines. So Depending on what kind of issue, it can be helpful, but it could also be even more helpful to be combined with herbal medicine in many cases.
All right, there's also a question, do you also do acupressure? And can you explain, if when you're answering, you could also explain what acupressure is for everyone, that would help.
Yeah, so within our license, as a licensed acupuncturist, we can also do acupressure or Asian style massage. That's part of our license. And as for acupressure and acupuncture, it's all related to the same channel theory. So those energy channels I had mentioned and those points, it's all the same theory. And if anything, I think acupuncture evolved from acupressure, because I think originally a long time ago, and there's no tracking of this because this was like way too long ago in human history, but it was probably that people noticed that there were some sore and tender spots that appeared on the body. And then according to pathology, for example, if you have a stomach ache or some sort of spasm, then, if probably someone in those times, like they realize that, hey, there's this tender spot. And if you rub that spot, then the stomach ache goes away, or there's some kind of therapeutic effect from this acupressure. So that's one way actually I also teach my patients that they can, if we find some certain spots on the body, they can work on that spot themselves. They don't have to just come in for the treatment on the table. I'm very much about people taking over as much as they can in their own understanding of their body and their healing.
Can acupuncture help an individual sleep better?
Yes. Yeah, that's one high, very often it's so a lot of I would say there's some kind of tendencies that modern medicine is better at, and some tendencies that traditional medicine is better at. And some of these very cyclical things like, okay, maybe I won't say better, but it's just, there's a lot of help within traditional medicine for things that have a cyclical nature, such as, for example, like having, your digestion, and sleeping, restoring regularity, for example, in the menstrual cycle. For women, there's a lot of women's health things that acupuncture can be really helpful for, especially if menstrual cycles, those issues due to a lack of regularity. So sleep is another issue that involves regularity, and that can also often be very helpful with natural medicine. And also because acupuncture by nature, it is pretty relaxing. It triggers that relaxation response and helps bring the body into the parasympathetic nervous system state if it's been locked up too much in a fight or flight sympathetic nervous system state.
So you mentioned cyclical issues such as menstruation. We had a question about whether you have any suggestions for menstrual migraines.
Yeah. I would say that one really, you have to get a clear diagnosis for what, I'm sorry for that. It's just because it really is a case-by-case situation. Is that it could be, so in Chinese medicine, we talk about excess or deficiency. So if someone is, for example, having what we call a qi and blood deficiency, and that is triggering the migraines, then we would have to build up their vitality. And then if someone was more in an excessive state of stagnation, so if their qi is kind of overly stagnant and it's like shooting up, causing these migraines, then we would relieve it in a different way than if someone was deficient. So I would have to really know what the person's situation is individually before I can say for sure. But those are some examples of what could be causing that.
I suspect this may be another one that may need more individual diagnosis, but would acupuncture or cupping, etc., provide lasting effect on cervical nerve pain, or would the pain need to be treated regularly for a long time?
I think that one really depends on how long someone has had that. And yeah, so it's very interesting because for neck pain, there's been a time where, for example, I had a patient who'd had it for a while, got some physical therapy, and then one treatment of like some ear needles even, and then the last 10% just went away. But then there's also people who they go back and forth, and it's just like not going away. And that can be related to issues in their life with their posture, if they're not exercising at all. Like there's other issues behind it that will determine how quickly it goes away, or if it just is kind of stagnant in that area. But I would say that if you're making proactive changes in your life, then there's a lot of hope for improvement.
All right, that's the last one that I caught. I asked in the chat whether I missed anybody's questions. So I'm going to give them another moment to type them in again or see if anyone comes up with more. But thank you so much, Dr. Lee, for sharing your expertise with us.
Thank you all so much. And thank you, Aiden, for hosting everything.
Oh, yes, there was a question about, I think it's about whether Chinese medicine has treatments for acne or eczema.
Oh, okay. Yes, yes. So yeah, so that would be balancing hormones for the acne issue. Sometimes there's also dampness and heat, according to Chinese medicine, involved. And one important thing that you could also take a look at just generally is your diet. And it could also be stress induced, but for definitely we have modalities that can help restore that balance. And eczema, often that could be related in Chinese medicine to heat in the blood. And so there's herbs that are really good for helping to clear that. But even with acupuncture alone, because there's some inflammation going on there, and acupuncture often can help to decrease the inflammation, then I've actually seen in treatment just from acupuncture alone that people can have those flares decrease.
Are there any books you recommend for those interested in more understanding of TCM?
Oh, okay.
Traditional Chinese medicine.
Yes. Chinese Medicine from the Classics by Sandra Hill. That one is a little bit harder to find because it's from a specialty bookseller, but that one is such a beautiful introduction to Chinese medicine. Chinese Medicine from the Classics by Sandra Hill. And also I had put up a picture of Between Heaven and Earth, a guide to Chinese medicine. And I think that was, let's see, it was here, yes. So this is also a pretty good guide to Chinese medicine. It's a classic in our field. Also The Web Without a Weaver, I believe, by Ted Kapchuk. That's also another introduction that many people know about as a good way to get into understanding this medicine more.
I know there were a couple questions that we didn't get to, but it is coming up on the end of our time. Dr. Lee practices here in Sunnyvale. Her practice is called The Precise Needle. And thank you so much, Dr. Lee, for taking your time to answer all these questions. And thank you everyone for attending.
Yeah, thank you so much, everybody. I really appreciate it. I hope you enjoyed it.
And that's it for tonight. Thanks again, everyone, for coming, and have a good rest of your night.
Thank you, everybody.